Be ready. Start. In a controversial move, the Punjab government has opened its district hospitals and resultantly lakhs of patients on a platter to the costlier private laboratories. Stop. No doubt the state's public health infrastructure is in dire need of strengthening. Stop. The disease burden has been mounting over the past decades, and COVID 19 has exacerbated the grim situation. Stop. It has necessitated an immediate overhaul of the woefully inadequate and crumbling system. Stop. But this this lateral entry of the labs is bound to come at a huge cost and strain to the poor. Stop. Has the government already forgotten how the pandemic exposed the ugly side of the private medical sector, which unethically restored to rampant fleecing? Stop. If anything, the private hospitals' open loot and daylight robbery that became the horrifying order of the painful days as hospital beds and treatment gear ran short of the need should have reaffirmed the state's resolve to expand the footprint of affordable treatment by setting up its own labs in its hospitals. Stop. Some private hospital operators have proved to be nothing but shameless gold diggers and opportunists. Stop. Aghast, the authorities had been forced to cap the costs of tests and treatment and even prosecute the offenders. Stop. The private sector has already failed the rest of time. Stop. The public-private partnership PPP model adopted by the Haryana government in some of its hospitals in 2017 has little to show by way of benefiting the poor. Stop. Punjab would do well to review its decision and work towards setting up its own laboratories. Stop. A booster dose for the government sector to revamp the district and rural facilities is needed. Stop. The state must loosen the purse strings and fill the gaps in its public health system. Stop. The chronic problems ailing the government hospitals have been pushing the sick to the private segment despite it being 5 times more expensive. Stop. That public health is grossly neglected in the state is evident from the NSSO study that 70% of the villagers in Punjab go for private health care as compared to the national average of 58%. Stop. The ill-boded decision on labs does little to remedy this malaise. Stop. India's COVID-19 vaccination drive has completed 6 months, but less than 6% of the country's population has been fully inoculated so far. Stop. In stark contrast, the UK and the US have completely vaccinated 52% and 48% of their people respectively. Stop. Among the other worst hit countries, Brazil and Russia are also doing better than India. Stop. The statistics are even more worrying when it comes to the average daily inoculation, which has been on the decline since June 21, when the new phase of universal vaccination was launched. Stop. Over 61 lakh doses were administered daily during June 21 to 27. The average fell to around 42 lakh doses in the subsequent week and further dropped to nearly 34 lakh during July 5 to 11. Stop.